all three speakers. Could I ask the three of you to now move up to the front of this room for the discussion period? Guru and David will be managing microphones for questions. Remember that no matter where you're asking a question from, you need to speak into a microphone because a large fraction of our audience is web-based. And please identify yourself. That was the last point. Thank you, Guru, for jumping ahead in my program. The other point is that if you're a web participant, you can submit your questions via indoor-pm@nas.edu. That is, send it in by email. Again, that's indoor-pm@nas.edu. So I'm in a moment going to invite the committee members to ask questions, but I have one kind of big question to pose to everybody in the panel. One way to think about the goals for moving forward is to focus on gaps. And we can think about two kinds of gaps that may be pertinent for our work. One is the gap between what we would like to know and what we do know. And you've spoken to many of those issues. And then the other is the gap between what we know, at least experts in the field know, and what we actually do in practice. And I think there's an opportunity here because we have EPA leadership in this area in the room to put in some seeds for where we think perhaps EPA or the federal government might take action with respect to those two gaps for indoor PM sources. So I'll give you an opportunity to comment, reflect, offer your opinion in response to the challenge of what's the big gap in one or both of these areas, the thing that you think we really should be paying attention to in the near future.
I want to put in a plug for kind of needing to give more attention to the design of the building and the ventilation in determining, influencing indoor air quality. You've heard about it as a factor in considerations like penetration efficiency and use of windows. I mentioned the unwanted exchange of pollutants between adjacent multi-unit housing. I think that's an area where there hasn't been much consideration as to what we might be able to do to improve indoor air quality for people living in their houses.
So I've got a couple of things that come to mind. First off, thinking of outdoor PM infiltration into buildings, since EPA regulates outdoor PM and that drives a lot of things, not understanding true exposures in the epidemiology health effects that we generate it's a challenge. So it's research that's got to be done, I think, to inform practice. So it's not quite practice, but it's a little outside of it. But it's important because it informs regulation and practice. When we think of building design, standards are an important part there. Standards also largely impact new buildings and not so much existing buildings. We have a lot of existing buildings, and those, it seems like, are probably the ones that are older and leakier and let in more outdoor PM anyway. So that's probably a high priority of figuring out what do you do with a large existing building stock. And then on the indoor sources, our recent experience with 3D printers has really highlighted. People are saying, well, what do we do about this, right? You either design some control strategy and you buy a $1,000 3D printer and then you buy a $500 ventilated filtered box to put around it. That's probably not the real solution moving forward. It's that at the very least, people have to know what these things are emitting into the indoor environment. So there's no labeling scheme. It's challenging because do you label the filament or do you label the printer? They point at each other and you label nothing. So, there are some ways that government and industry consortiums can kind of help some of these things out with just improving knowledge for the public.
I'd just like to add, in regard to communicating our research to the public, I think this is something we need to work on, especially, let's say, for infants and sources of relevance for infants and children, and communicating sources such as, particle resuspension, and not just particles, but various gaseous species. So communicating that to, let's say, expecting parents about what products they should buy for their home. What should they do in regard to either installing a new filter or the type of filter for their home? These such things I think would be particularly useful. Yeah.
Thank you. Anybody from the committee who'd like to pose a question to this panel? Tina?
Just a comment. I was so glad to see so much content on bioaerosols from Lynn and Brandon. So just wanna remind everyone that bioaerosols is an important part of the components of the PM. And similar as other types of particles, they are indoor and outdoor sources, and from penetration from outdoors to indoors is governed by same principles of the tightness of the building, opening of windows. But for the indoor sources, so Lynn kind of talked about, if I understood correctly, primary emission from damp surfaces, and Brandon talked about resuspension. So just want to point out that there is some studies from the emission from damp surfaces, and our group and some other groups from around the world have done studies, and it is known that microbes are released easier into the dry air than humid air, and the increased airflow increases the release, and then also vibration increases the release. But most importantly, these studies have shown that there are also these small fragments that Brandon mentioned. So we should keep that in mind, that it's not just the intact particles, but also these components can be in the smaller size fraction.
Bill?
Yeah, I think 3 wonderful presentations.
Sorry, Bill, but a reminder to identify yourself.
Bill Fisk from Lawrence Berkeley Laboratory. 3 sort of categories of sources that weren't addressed very explicitly. One is the outdoor air as a source of allergens and inflammatory agents, or the outdoor environment brought in either via air or tracked in, I think deserves a lot of attention. An area we don't know much at all about, but could potentially be important, is the HVAC system, and particularly the wetted surfaces in this system. How important is that? We know that air conditioning is a risk factor for respiratory outcomes. Is it because of particles on wetted surfaces to which we are exposed? And the third area that serves some attention is the outdoor air is also sort of an episodic source of particles, for example, from wood combustion or wildfires. And I think those episodic situations deserve a lot of attention as well.
Yeah, Howard, please.
Hi, this is a slightly different angle. I want to pick up on Brent's first or second slide when he showed what we all know, which is that we spend over 90% of our time indoors, and plenty of that at home. EPA regulates outdoor air pollution based on a substantial and sustained epidemiologic database, which measures outdoor air and associates that with death and dying from very many different causes. The associations there are with outdoor air, but if people are spending all their time indoors and we have a 50% infiltration rate, it seems likely to a lot of us that the actual exposures driving those death and dying health outcomes are indoor exposures, perhaps to outdoor origin particles, perhaps not. But I think we're not going to redo that whole epidemiology if we could ever figure out how to do it. We need to pin down whether the associations with outdoor air really do translate to indoor exposures. And I'm not here to suggest how we do that. There are some back of the envelope ways and maybe others. But I think we need to think about that today. And as we get to tomorrow's talks on health outcomes, I don't know that they're going to suggest how we leverage those existing data, but I think we need to do that to then decide whether the interventions that we can demonstrate are really going to protect health.
May I make a comment?
Yes, I don't know who said that, but
Brandon.
oh, sorry.
I think related to this is, as Brent mentioned, that we don't have much data on indoor PM2.5 ultrafine particles at a large scale. And I think one opportunity that we should explore is the use of these low-cost particle sensors. I'm sure some of us are familiar with. Not only, well, first testing them to see how accurate they are. We know we can detect large particles quite easily with fairly cheap optics. Smaller particles down to 10 nanometers or so are a bit more difficult, but there are cheaper methods that are now commercially available. I mean cheaper, I mean 5, 10,000, where we can detect these particles using diffusion chargers and other such instruments. There's just a few papers published, I think, in Aerosol Science Technology on low-cost differential mobility analyzers, which is, of course, an important component to scanning mobility particle sizer. So there's even the possibility that one day we may have a very cheap SMPS type system. And I think if we push towards that direction, it would be very useful for us to have large-scale data, size-resolved data on particles, just from down from a few nanometers into the coarse mode. If we make these distributed sampling networks in cities and in homes and so forth. I don't know if that will be discussed in any of the other presentations here, but I think something we should certainly be talking about.
Thanks, Brendan. We have another question from the audience here.
Thanks. My name is Joe Hughes. I'm with IAQ Radio, and I've probably got 5 or 10 questions, but I'll stick to the biggest one first, and that was on gaps, and in particular between industry and consumers and research. From my perspective, the biggest gap at this point is on mechanical systems cleaning. We're relying on 1991 data and a 1991 paper from EPA on should you have the air ducts in your home cleaned. And we really need to update that information because people were doing it whether EPA's document recommends it or not. And it's being sold out there on a regular basis. And it's a huge issue within our industry. And I want to mention also, Brandon, that's a great point on the low-cost analyzers, particle counters. I was just talking to a couple of the people here that do this type of work in the field. We can't afford ultrafine particle counters to do the type of work we do. And what I gathered from the presentations this morning is that's a pretty important piece that we're probably overlooking oftentimes out in the field. So those are just 2 comments on those sections. Thank you.
Thank you. Barb, I'll put you in the queue if I may, unless you were going to directly respond. Yeah. So let's take one question from the web, and then we'll come back into the room.
This is a question that was submitted by Todd Breithauer. He writes, how much of the particulates from the surfaces come from cleaning product residues such as waxes and surfactants, and from the floors and other horizontal surfaces such as tables and counters? He also writes, how do these cleaning product residues alter particle resuspension of other materials such as pollen, spores, bacteria, cell debris, and the like? He finally offers a question I believe we'll address later on in the session when we get to remediation. Are cleaning products just cleaning or making us just feel good?
So a bit of that will be addressed specifically in the next session on chemistry, but and recognizing that a bit will, I'll invite the panel to respond to the other.
I'm not so familiar if any studies have really looked at how residues from cleaning agents and, let's say, for fabrics such as clothing and bedding materials, residues from detergents, the residues themselves, how they, if they are some sort of particulate residue or some sort of condensed vapor or something that may reside there. I don't know if anybody's really looked at that specifically in terms of resuspension. I imagine if you have some, let's say, accumulation of some semi-volatile organic compounds onto surfaces, perhaps that may affect particle adhesion by changing the surface chemistry and the Hammaker constant, but I'm not quite sure.
Two comments, well, three comments relative to that. Yes, I think more work needs to be done in that area. When you think of cleaning products that involve sprays, you should realize that some of those spray droplets never make it to the surface. The carrier, the solvent, evaporates, and if there are things like waxes being delivered, then those end up floating around in the air as airborne wax particles. The other comment is related to detergents. What I do know is laundry detergent enzymes can be detected in dryer lint after washing and drying clothing, and it's detected in its active form. And so even though it starts out being shielded with a coating, apparently that coating disappears. And so you might think, at least for laundered clothing, that in addition to just all sorts of dust coming off from the clothing, that there may actually be some allergenic material as well.
Interesting. Let's turn back to another question. Charlie had raised his hand a few minutes ago.
Charlie Weschler from Rutgers. I'd like to return to Howard Kippin's comment and comment on that myself. Consider three classes of PM found indoors. We have, or I'm sorry, more broadly, consider three classes of PM. Outdoor PM, indoor PM of outdoor origin, and indoor PM of indoor origin. Given what Howard said regarding the epidemiology studies, the fact that they're based on measurements of outdoor PM at central site monitors, and yet the bulk of our exposure is occurring to these outdoor PM particles is occurring indoors, I would argue that we actually, considering those three types of PM, we know more about the risk of indoor exposure to outdoor PM than we do about the risk of exposure to outdoor PM or exposure to indoor PM of indoor origin.
Yep, please, yeah.
I agree with that, but we need to make, that point isn't made and that point isn't regulated. So we need to kind of actualize that and maybe do the calculations. And while I have the microphone, I'm just going to say about the cleaning products that pretty much the most exciting thing in occupational asthma epidemiology research is the association over the last 10 years between people who do indoor cleaning for a living and developing increased rates of asthma. And some of that has extended to people who are just non-occupational users of cleaning products. So I think there's some real health relevance to that question that was asked.
Barb, I think you're up.
Okay. So, Barb Turpin. So I would guess that the aware public, the public who is concerned about exposure to indoor pollutants, are about equally likely to, when they do something, to do something that improves, that reduces their exposure, or to do something that increases their exposure. And in fact, I would argue that I'm a pretty aware member of the public, but I think that we don't have good guidance at this point under what conditions and what situations is it good for us, or even from the standpoint of exposure, not even having to do with health, but under what conditions is it good for us to increase ventilation versus decrease ventilation. And I know we'll talk about other types of interventions later, but it seems like a relevant point for this group.
So we've run to the end-ish of our time, and we only have a 15-minute break, so we will take that. But I want to give the panel one last chance. If there was something we didn't ask you that we should have, just like in an interview, you get the last word.
just to follow on Charlie and Howard's discussion, I think Charlie, you're onto something, and I think what's really tough is that there's going to be, and this is actually off of Barb's comment as well. It's really tough to find solid health-related information. You can wonder about the physics of what's going on, or the chemistry of what's going on a surface, and what you're exposed to, or what you're exposed to when you squirt this cleaning product on this surface, and so on. But Howard kind of said it. What we really learn from is these large epi studies of really intensive household cleaner users, because we understand their exposures a little bit. We don't understand the background physics and chemistry and everything they're actually exposed to. So getting from knowledge of physics, chemistry, and biology to health is a massive undertaking. That's a real challenge. And since this committee or this workshop is on the health effects of indoor PM, I hope that we can elucidate more knowledge on and more methods as we move forward on how to address those.
Barb's comment about how do we communicate this to the public made me think of carpeting. We here in the United States love our carpeting. And so an example that would be very relevant to what she was raising is kind of, do you vacuum more because that will reduce the resuspension between vacuuming, or do you vacuum less because of being exposed to such high concentrations during the vacuuming? In my opinion, that's the wrong question to ask, or the wrong thing to think about. You should think about how to pitch to the public that they shouldn't have carpeting in their home, because floors are much more efficiently cleaned, and the resuspension rates from walking on flooring is much lower than on carpeting.
Actually, in regard to the effect of vacuuming on resuspension, in that study on the infant resuspension, I vacuumed the carpet and also measured the breathing zone concentration, and was reduced, but not by a significant amount. And the size distribution shifted a little bit from, towards lower particle sizes. So maybe perhaps 10 micron particles are being removed, but the smaller particles, 8 microns and less, are not so efficiently removed. So I think the size resolved removal efficiency due to different types of cleaning activities of particles embedded in carpet fibers should be studied.
Thank you all. Before we close, David's got a word, and then we'll be on break.
I wanted to thank the people who submitted questions online. We have those questions. We will keep them and use them on a time available basis. We are going to break until 10:45, and please keep very strictly to that time limit so we can give as much time for our speakers as possible. Thanks very much.